good, the store will have it for sale. And where can do I have to go online to buy it? Where can I buy the smooth flour?
Yeah, so this is the big challenge for those of us trying new things, and Dave could answer the same thing. The stores don't pick you up in big volumes until there's big demand. There's no big demand until people know about it and know to even ask for it. You should be able to find Bob's Red Mill packaging in every health food store. They're our biggest customer in North America, and they have small packages of kamut flour and kamut grain and even the ground stuff for hot cereal. But if you want bigger bags, then call Montana Flour and Grain Direct and see if there's any place that can get it closer to you in Bozeman, or even a co-op that can get bigger bags in. But at least Bob's Red Mill, Eden Foods for pasta, Nature's Path for cold cereal, Subsidies for flatbread. Most of those, at least the top 3 brands, are carried by all the health food stores. And if they carry the brand, they can easily get that product of food, even if it's not in the current lineup.
Thank you.
Yeah.
Town and Country usually has Bob's Red Mill chemical flour.
David.
Yeah, I'd encourage you in your program to not be reticent about reaching out, to the producers to participate in your program if you're not, really doing that. I mean, Bob, myself, and there are others in the state,
Can you talk a little bit about what your business is, David, just so that everybody on the panel and the audience knows?
Okay, yeah. My business is Timeless Seeds. It's basically a 32-year-old business started by 4 Montana farmers, focusing on certified organic peas, lentils, chickpeas, and heirloom grains. Okay, and as a part of that, well, back to the reason for inviting the farmers in, because each of those farmers, producers have a, in many cases, have a very compelling story, and it is connected to health, as Bob, touched on very dramatically, frankly. And I think, in my experience, going around talking to folks around the country and so forth, is that making that connection between the kitchen and the farm and the farmer, can actually speak volumes to, in this case, the medical students. And we both work with chefs, so if you want a chef to come in, and help with your cooking demonstrations or whatever, tell the story about why these chefs are so excited about it, and the importance on the nutritional side and the health side. We'd welcome the opportunity to participate with them. This is very exciting. What you're doing is very exciting.
So what we do in the program is they get 1 hour of teaching. So for instance, they learn about the Mediterranean diet.
Right.
Then we go and we cook the meal, and then we eat the meal. We do have the farmer from Town's Harvest for our very first one. He goes around, teaches them, shows them the whole organic garden.
Right.
A lot of the produce that we get is from there.
Yeah.
But we don't go that step further to invite in more farmers, which would be very interesting and I think worthwhile. It would be hard for you where you live so far away.
That's only 300 miles.
But
We're in the same state.
But
We're in the same state.
I'd love to get your name because it is good for them to see who's doing that. That's one of the reasons I go to the co-op. I love that. I love seeing the pictures of the farmers up there. I know the farmers most of the time, and making that connection is important. When we buy fast food, we have no idea where that comes from. There is no connection.
Right.
And that
So-
connection
And not only who's
translates-
doing it, but why. Why did they start doing that?
Yes.
I
I'd love
think-
to get your name afterwards.
I think that MSU Sustainable Food System Program can help as well, because we actually do a field trip up to Bob's Place every summer with a group of students. Why couldn't we include the Culinary Medicine team as well, potentially, although I realize the dietetic interns don't start till August, but we could do another field trip. And we field tripped up to various lentil growers that are providing product for Timeless Seeds, and up to the Timeless Mill in Conrad. Not Ulm, just south of Conrad, south of Great Falls. Yeah. So, yeah, there's all sorts of connections to these larger producers that outside of the Gallatin Valley through other entities at MSU, so definitely we should all be collaborating on this together. That's fabulous. I see other questions. Let's start with Josh and then we'll go to Diana.
Question for Bob as a producer. You were talking about when your people were first talking about the problems with wheat, you were kind of upset. What helped you kind of turn the page on that and overcome that?
Well, organic was the first thing. But I really didn't have much to say until we started our research and started to really understand what was the source of all the trouble. And then it became a whole story then. But we just approached it just one thing at a time. First of all, we were offering an ancient grain that people didn't have this problem with. We didn't really know why, but most people, 85%, could eat it just like it was. If we made sourdough, that increased, even a little bit more. So that was our first, that happened all about the same time. The big push with wheat-free, gluten-free actually came after we had discovered the wheat, the less sensitivity that can move the people that had trouble. We had already had sold into that when it was just getting started. It wasn't a big item yet that it is now, and the research was just coming out. In those days, and this is the trouble, I couldn't find the researchers that would work with me here in America. Most of them said, if I did that kind of study for you, I'd be wasting my time and your money, because a lot of this trouble is just in people's heads. And even my brother-in-law, who was a psychologist, that's what he believed, because that was kind of a general belief among a lot of the medical and certainly the research field at the time. Now things have changed, and that's no longer the case. But in the beginning, that's what it was. It was so difficult.
You'll be happy to know, Bob, in our program there is no white flour. Even our desserts, it's all like whole grain,
All right.
nutty, delicious desserts, and they taste great.
Yeah.
You know,
Yeah.
and they learn all about lots of different flours. And,
Yes, and your microbiome loves it.
and the microbiome loves it. We teach about the microbiome. Yeah, so,
that's great.
yeah.
Diana?
So I understand that Montana has had in the past a problem with keeping its own grain here, that farmers used to have to sell their grain over to Asia, and they would mill it and then send it back here in the form of noodles. So I'm wondering, do we have enough mills processing Montana grain for Montanans? And if we don't, why don't we, and where do we go with that?
No, we do. We have enough to process it, but until the big pasta company in Great Falls started up a few years ago, we didn't have really pasta production capacity, but now that's been bought by a Japanese company, and I think most of that goes to Japan. So we really aren't eating our own noodles, if you're talking about noodles. We're not even eating, I don't know what, it'd be interesting to know what % of our own bread we eat. When I was a kid, Eddie's bread was everywhere. That was a big one in our area in northern Montana. They're completely gone.
So question, the mill that you're speaking of, you said it was bought by the Japanese?
It was a pasta manufacturing, Pasta Montana, in Great Falls.
It's the pasta we showed you on the shelf yesterday,
Okay.
because we buy it in 1,000-pound totes.
So but I don't know, it's
Better than that.
generally in the grocery stores here, is it?
I don't think I've seen it.
I think you're speaking to some of the really complex issues of our current industrialized food
Yeah.
system and the concentration of the food system. And that's, I mean, honestly, that's why we're all here together this weekend, is because we're all from different parts of the food system trying to tackle the problems that have arisen over the last 70 years of how things have been done, and how are we going to change that, one community at a time, or one initiative at a time from some of the examples that you're hearing here today. But you're absolutely right. Our processing infrastructure in the state of Montana is not supporting the production that's happening here in the
So
state.
just like we have these regional kitchens that are starting up in different food banks in different areas, we need regional mills perhaps, or maybe a mill in every kitchen so that everyone could have, when does whole wheat start going bad? Maybe a few days after you mill it? Or maybe, how long does it hold its nutrition? You know, when is it good for you? Like, if you eat an apple and you pull it off the tree, it's highly nutritious right after you pull it off the tree. So how
Sure.
long do our grains really keep? And so, like, sending it across the country to be processed and then buying it in the grocery store is ridiculous.
Okay, so folks, if you're looking for something for Christmas and you don't have a small tabletop flour mill for your kitchen, that'd be perfect. Because, and also, if you buy lower down on the food chain, everybody can afford it. So I tell people when I go around, we eat a lot of hot cereal in the wintertime. So I bring in my kamut, and even if it's selling for $2 a pound, which is pretty expensive in the store, if you bring that home and you put it through a little, I have a hand grinder for that to crack it, and you eat a quarter of a cup is a lot. You can't eat more than a quarter of a cup. And so a family of four, you're talking about what, 50 cents or something for feeding a family of four hot cereal that you prepare yourself, and it takes 10 minutes. 10 minutes. And if you have a flour grinder, you can make flour and make biscuits and bread and pancakes and everything. And you're talking about freshness. Of course, the fresher you use it, the better it is, the more nutrition there is. So if you have your own mill, why grind a week's worth? You know, why just grind a cup at a time or half a cup, whatever you're going to use, and then use it then, because everything, all the vitamins are right there, and they haven't deteriorated. You can slow the deterioration by putting it in the freezer, but the fresher you use any food, the better, the more nutritious it's going to be.
I also want to say one more thing because our lentil expert is here. I just discovered lentil lasagna noodles in the store, and I don't know who's producing those. I found them in a health food store, but they were absolutely delicious for a plant-based lasagna. And I don't know if you've seen that product, but they're making pastas out of beans now as well.
Yeah, you know, the whole plant-based protein or plant-forward, you know, menus, I mean, started about 4 or 5 years ago, and I mean, it's just mushroomed the interest in, you know, both for home kitchens, but particularly in restaurants. You know, if you go into an urban area, I mean, plant-based, that's kind of what it's all about. That's kind of the trend now.
Right, and I honestly, we're not even touching on greenhouse gas emissions here in this dialogue, but if we start talking about that, and then the dialogue around plant-based foods
And carbon
becomes even more
sequestration
important.
is organic.
Yeah, right.
Okay, can I put in a plug for Dave's lentils, organic lentils? Because legumes are all in this country desiccated with glyphosate, almost all of them. Only a small part of wheat is, and we still see the trouble we have with wheat.
So what does that mean, desiccate?
Means that you spray on glyphosate, Roundup, so that you dry the plant and can harvest it sooner, and you don't get snow or rain or whatever.
10 days before harvest.
It takes a long time to dry
10
down.
days before harvest.
Yeah.
Sprayed with herbicide.
But guess what, folks? Not everybody waits 10 days
Yeah.
to put it in the combine.
I see.
And the sooner it goes in the combine, the more residue there is. So even if you go down and you think you're buying hummus and you're doing a great thing for your body, and it's not organic, you're probably getting a good shot of glyphosate. So that's really a food to support organic with. If you have to start somewhere, you're not starting everywhere. Start with the legumes.
And in one of my medical journals, I was just reading how the Impossible Burger is tainted with glyphosate, so everyone should be aware of that.
Yeah, and some GMO stuff.
Yeah, oh my gosh, we could have an entire dialogue on the Impossible Burger.
Oh, yeah.
So, I just wanna make sure, the woman in the back room has been so patient with the black sweater.
I just have a question for the UnProcessed, the Impossible Pantry Project. Hard to say, isn't it? I had Impossible Burgers stuck in my head. So I'm curious how you weigh bringing in unprocessed products into the pantry against some of your shoppers who don't have access to a kitchen, and how that affects them. I think there's a good proportion of people that shop at the food bank that are homeless, couch surfing, don't have a refrigerator, maybe have a microwave but not a working stove, and how we still take care of those folks who might be facing a choice of no calories or calories from processed foods. So is there like a balance to be found with UnProcessed Pantry Project?
Yes, there is a balance to be found. I think that percentage of people that don't have the ability to, the homeless it's a very small population, because again, the point of, if I give you a bunch of food, it doesn't help a lot. Where I would like to go, we're not there yet, is that we need to be able to have ready-to-eat meals, and they need to be healthy, nutritious meals. And Michael McCormick is doing a great job of that. In 3 years, I hope to have a commercial kitchen, and I too will do that. But until then, the options are not awesome. We get food from the co-op, and we get food from some places where there are good choices, and they're ready to eat meals. So those would be what those people would take. And the people that don't have a kitchen and don't have the ability to cook, they're typically coming more often than the rest of our shoppers. So does that kind of answer your question?
Yeah, definitely.
We can do better. I know that, and that is the goal. Yeah.
So if they're allowed to come more often, they're not limited to like twice a month.
So regular shoppers are once every 30 days. Everybody else is like kind of an on-need basis. For the UP3 project, we came every single week. And so the majority there was only one person who actually was homeless in that group that we served. And he just came more often, and he ended up eating a lot of fresh produce. Yeah.
Thank you.
So, question on fruit and vegetable prescription programs and your familiarity with that, specifically Wholesome Wave?
Livingston's doing it,
Yeah. Okay.
And Michael and I and the health department were just talking, and they're like, let's do it. So we'll see what happens. We can hopefully get that moving. May need your card too.
Great, thanks for bringing that up. Do you want to describe it?
Yeah.
Briefly for the audience?
Sure. Yeah, so basically, in Novel Nation, how we did it was we worked with local clinics and health practitioners, identified community members who could benefit from the fruit and vegetable prescription program. So like the program to them, if they wanted to, they would sign up. And then they would receive prescriptions to take to local retailers that we trained to accept them and purchase fruits and vegetables that are frozen and fresh, healthy options. And then in conjunction with purchasing those things, there was monthly education that the whole family was invited to attend to learn how to work with those different products and receive nutrition education and so on.
One follow-up question, are they using their SNAP benefits for the purchasing power?
No,
It's
it's completely separate, yeah.
separate
So
from
the RX Foundation actually oftentimes helps to fund the money for the prescription.
Okay.
It's also waived, yeah, but, and it does not affect any other benefits programs that
Great.
they're paying out.
Great, thanks for that
During
clarification.
the last session I was at,
Uh-huh.
I was just celebrating that.
Yeah, and I.
Did you talk to her?
Yeah.
Perfect. So they're doing it up in the black.
Yeah,
So it's the only place I know in Montana, but.
yeah,
So you're
really
connected with her.
excited for it.
Cool.
One other question? Somebody,
She raised her hand, yeah.
there you go.
My question is for healthcare people or the food bank. How do you have that conversation with people about how food affects their health? If you get someone that comes in that has some health issues, or maybe even doesn't, how do you go about trying to convince them that eating better will improve their health?
So I think it's going to depend a little bit on the specific condition that precipitated their coming in. You know, someone who has maybe cardiovascular disease, how I'll approach that patient is going to be different than someone who's coming in with like type 2 diabetes. You know, because their problems are going to be a little bit more focused, like for cardiovascular disease, more focused on sodium and increasing healthy fats, while like diabetes is going to be more focused on where they're getting their sugars. So we kind of approach it first by finding out what it is that they're in for, like why they came to see us, and sort of just talking about what their diet looks like, and then beginning to kind of see, okay, like, you know, maybe we talk about like 3 or 4 different points of things that maybe they could change and see where they are and how they feel about changing one or two of those aspects, and oftentimes with the dietitian, they'll come in and see them again and follow through. But yeah, I mean, sometimes you'll get patients who really don't think that there is a problem with their diet, so oftentimes we talk about the science in, a relatively simplistic or basic format of saying, okay, well, this is what's actually happening in your body with X food or Y food, and that's part of the reasoning behind how this sort of ultimately developed. Does that answer?
Yeah.
Okay.
Does either of the other health folks wanna address that?
I think what helped in my discussions with that was just like, I feel like the typical thought of like eat healthy is just like a salad just appears in my mind, and that's, I think what happens with a lot of people is they're like, and the fact that you can eat healthy, you can have pasta, that's a healthy option if it's like a whole wheat pasta, that you're going to like feel fuller, that maybe you'll have more energy. Just letting them know that there's like a diversity of options, and there's so many ways to eat healthy or to, eat lactose free or gluten free, and that if you don't like one thing, that there are a lot of other options out there to try. And it's sort of the same thing that we do with the prescription. If you have side effects that you don't like, there's a variety of options, and just letting people know like eating healthy is not just a salad, it's not just one option. It can be really like tasty and fun too. So
It's a wonderful question. It's very complicated. You can't convince anyone really to quit smoking or eat a healthy diet. They have to want to do it. And it takes years of learning interview skills, motivational interviewing, and a trusting relationship. And then using what they've also said often will, provide some benefits or show some change. And sometimes people just never change. They're going to eat fast food forever and have a bad diet, and we still take care of them and care for them in a good way. But it is not easy, and convincing doesn't work. You have to wait for them to really ask and to want to change. Then you can use these methods that they say, and we work a lot with dietitians to help there. It's not an easy question. Thank you for asking it. Yeah.
I have one thought about it, and it's kind of unfair, but we have a captive audience. They need food. And so when you talk to them about, the recruiting for the UP3 project was not hard, to at least get people interested. I don't know if you have anything to say about that, Nick, because you did a bunch of the beginning interviews. What I can say is once we got them in, like they said, yes, I would like food every single week and I would like to try to eat better. In that first, it was our markers was about 7 weeks almost, 6 weeks. They already had more energy. So they already felt better. So that in my mind is the hook. It's like if we can just get people to that point where they can feel it, then we might make a difference.
Yeah.
And the other thing was people with kids, because they wanted to do better for their children and they didn't know how to go about it. And so to be able to give them that opportunity, like one of the moms was so funny. She's like, I'm putting kale in everything and they're eating it all. And it was just such a great moment for all of us, so.
Yeah, and maybe one of the sort of biases that exists with our study is everyone who got involved is, or was at least at that part of stage of change where they wanted to change, which might not be something you always see in patients that are visiting you. But another part of it too is it's really incremental, step-by-step changes. And with our project, we had the benefit of seeing people every week where you're able to either teach a nutrition education lesson or do like an individual check-in every single week with somebody. So there really was that ongoing accountability and the ability to incorporate those small gradual changes as it went on.
Thank you all, those were great answers. Any other questions? I have one, that I had a whole list, but now I pretty much know one. Because this one always interests me, so I'm gonna be selfish about this and ask it. Policy is a really important leverage point for change. And policy can happen at the organizational level, the local government level, the statewide level, the national level. It happens at so many different levels. I'm wondering if each of you can talk a little bit about what you think are some of the most important policy levers to be paying attention to move forward, to make progress in this effort to improve the well-being of people through food system efforts. Oh, Jill, you've got something up your sleeve, I know you do.
Well, I don't need to go first.
Oh, okay.
Um,
I know Bob's got something.
Yeah,
yeah.
you go first. My first policy is our whole food bank crew is gonna read Bob's book.
Well, I have a couple things. One is in this country, well, first of all, a ray of hope, okay? In the last 35 years that Dave and I, and not too many others have gray hair here, but they, like we do, have been working to take organic from almost zero in the grocery store to now to over 6% of all food sold in America is organic. And at the current, that was a big effort. That was a big effort. But the good news is for those of you in the rising generation that are just have almost your whole rest of your life ahead of you, in the next 35 years, at the current growth rate, it's the fastest growing segment of food, we'll be at 100%. And if you will walk through the door we've opened and finish the job that we didn't get done yet, your children and grandchildren will thank you more than you can imagine, because then you can say after 100 years, the great American experiment of chemical agriculture is finished. This would be a huge legacy, because the result of that is what it does to health. And the great American health crisis then may be over. We're still going to have disease and sickness, but we're in a crisis. We're heading for a real train wreck. No country can long exist where a significant number of its people, a significant percentage, is chronically ill. I go to Congress lobbying all the time, and I don't love on this subject, but I always bring up the problem of healthcare, the debate, healthcare system debate. I said, what you guys are doing back here in Washington is asking the wrong question, as usual. I don't say that right. The correct question is not which is the best healthcare system. The correct question is, why are so many people sick? And if we answered that question, so you're talking about policy, if we would make a conscious effort to ask that as a policy, to go to the source of the disease. Right now, Big Pharma is in cahoots with Big Chemical Ag, and Big Pharma says, we're going to treat your disease. Don't you worry about a thing. We're going to have a pill that fixes everything. It'll cost some money. That's okay, right? Everything costs money. But we're going to fix it. But they never, ever, hardly ever look at the root cause. They only are treating symptoms, and that's where they're making all their money. If we would ask those questions and then stand behind policy changes that would respond to the answer, that would be huge. And for agriculture, I would say the biggest thing I would like to see changed is the emphasis on research. Right now, we have 6% of the food in America is organic. 1% of the research is dedicated to organic production. 99% is dedicated to our chemical production.
Can I have a clarification? Do you mean federal research
Yes,
dollars?
federal research
Research dollars.
Okay, from USDA. We've got a big increase in the last farm bill for organic, but we're still only hovering around 1%. It's like, and I tell my friends, it's like 120 years ago when the car first started to appear on the roads, and it was obvious it was going to be a successful invention, that 90% of your research dollars are still focused on perfecting the stagecoach. And that's what we're doing. We're really focusing on the wrong thing again. We at least ought to be up with the 6% of where we are, and research by definition should be ahead of the trend, not falling way behind. There's no reason in this country we couldn't have 6% of the farmers organic supplying 6% of the food. We are importing a lot of organic food because the agriculture is not keeping up. A lot of farmers are afraid. They don't know where to start. They have no encouragement from county agents, and only now we have some encouragement from universities, but in the past non-ovals, chemical companies are pushing their brand of agriculture. That's where all, and just the peer pressure is enough to keep a lot of people from trying, even though the economics are dire for those in non-organic agriculture. So those are the two things I'd like to see.
Thank you.
I'd like to see changes in subsidies as well. I mean, I don't know why we are subsidizing corn and soy. 90% of our subsidies go toward that to feed animals. It's not organic, things are sprayed. We need to somehow change the government level that creates and gives out the subsidies so that we're subsidizing small organic farms that were much more local, much more sustainable. I mean, we have to see the big picture. And I hope some good comes from climate change where we're able to see the big picture and make these changes. Because otherwise, I don't have as hopeful a view of the future, unfortunately, unless we make these changes. And we need a government that will listen and do that and is not owned by these chemical and big pharma industries. So a lot of things need to change, and we're actually hearing politicians and government talk about this now for the first time, since I've been around, and hopefully we can see these changes and changes in subsidies, changes in research. I think these things would definitely make a difference. And also in, we give out SNAP and, our poor people, why are they buying the lowest quality and the worst foods? That should not happen. There should be certain foods that they're allowed to buy, and more education, especially of our physicians. So all of those things, yeah.
Thank you. And Jill, did you have something to add to the policy?
Certainly would second the subsidies. I guess the other thing is just maybe not as big scale, but just somehow we have to figure out food waste and water waste and saving farmland. Like, those are big things that we have to not let run away from us.
Great. I guess I want to turn it over to the audience too. Are there any policy leverage points that people in here would like, or everybody else to be thinking about in terms of leveraging the power of the food equals health equation? Diana, you have one?
I'd like to see our saving seeds as being essential so that we don't lose the right to save our seeds, so that they're not all owned by conglomerate biotech companies, so that farmers or gardeners can't have seeds that aren't heirloom or just native seeds that we collect in our gardens.
So kind of the issue around patenting biological life there.
Life in itself.
Yeah, okay, interesting. Tanner?
Yeah, on the point of education, I think the lower education levels, I grew up with Sam and we had pretty crummy nutrition in our schools growing up, so implementing that early in life, and then you don't get physicians in training coming to you who don't know anything about how to cook or prepare food.
Yeah.
Maybe you could get some of that education in early and
Awesome. I don't know if either Dr. Kirchhoff or Jill, in terms of Head Start and that treats or deals with the most vulnerable of our children, there is a fair amount of nutrition initiatives with the Head Start programs. I don't know if you've worked with them at all.
Have you?
Well, not close enough to speak to it.
I've had patients that are in the program and the diets are not that good. No, they're not good. But there is a farm to table program. School to farm.
Farm to school.
Farm to school here in Bozeman, and our elementary schools, it's not all of their diet, but they're getting quite a bit of their diet from food that's even grown in the school sometimes. So that's been a pretty successful program. Yeah.
Yeah, and actually one more piece about that, just because Tanner, you're hitting my area. So the Child Nutrition Bill is our big piece of federal legislation that governs the nutrition recommendation for school meals. So the school lunch program, school breakfast program, after school snack program, there's a number of different federal programs that are administered through the Child Nutrition Bill. And in 2010, there was significant improvements. And actually, it wasn't Michelle Obama's doing, but it happened to be timed right with Michelle Obama hitting the White House with her husband. And her initiative was child nutrition as a first lady. She was very much, as you know, around improving child nutrition. So a lot of people were referring to it as Michelle Obama's school lunch program, but they were actually two different things. But there were significant improvements in the school lunch program in 2010, which have been rolling out in the years since then. Lots of area for improvement still, but at least there are some nutrition standards which are determined by the Institute of Medicine that actually is the governing or the scientific body that informs the federal nutrition standards. So we're heading in the right direction on that, yeah. Oh, yeah, go ahead.
Just wanted to make a comment and a plug on the subject of early care and education and the farm to school. That education piece, the Harvest of the Month program, which a couple folks may have heard of, that's very active in K through 12 schools. It's a statewide program, but we do have that available for early care statewide as well. So just wanted to make that plug.
Thank you. So oh, go ahead. Did you see one more?
I did, yeah.
Oh, there you are.
I'm a physician, one of the street physician, and I'm also organic, manufacturing organic. I've recognized for a long time that what we do get to the food, and say that we have a lot of problems. One of the things that can be done, I think, is consumers insisting on education about nutrition. And one of the pitfalls about our healthcare reimbursement system is it doesn't emphasize that. And I think that if that was emphasized more with healthcare reimbursement, it would become things.
So consumer nutrition education linked with healthcare reimbursement.
That's right.
Yeah, brilliant. Anybody else want to comment on that?
Yes, I do. Dean Mornish's program is approved by Medicare. It's mainly a plant-based program, but he was the first to pioneer that with Medicare. And so it's available, I think it's available in quite a few hospital-type institutions. And I think Kaiser also has a similar program.
Anyone else? So we are almost at time. We've got 3 minutes left. Any closing remarks, Bob?
Yes, I had one real short story that I thought was really encouraging coming from the other side of the world. I had a chance to visit Mongolia a couple weeks ago because in Mongolia they have a policy of promoting organic agriculture, and they want to change all their organic production to organic, or all their food production to organic. And I accompanied my son and his professor who were food scientists, and they were concerned with food safety and food preservation. And we were in the office of a vice president of one of the universities there in Mongolia, and they said, what is your main food safety concern? And this very high up educator and in the university said, our main concern in this country is the rising of cancer among our people. And we think it's related to food, particularly tainted with pesticides and herbicides. And that is why we're so interested in having an organic promotion of organic production of our food. And I never heard that before. I just about wanted to jump up and cheer because I asked my son's professor afterwards, I said, have you ever heard anybody mention pesticide contamination as a food safety program or concern? Because food safety by definition is bacteria and all this stuff that they worry about in food contamination. And he said no. And I said, in this country, a high-level person said something like that, their job would be gone the next day for sure. It would be heresy. And I thought here we were in what we term as a backward country or undeveloped country. They have more vision than we have in the highest levels of where they want to go with their health and their food. And it gives me great hope that here in scattered portions of the world, we may have to look for leadership in other parts of the world besides the United States to really show us the right way, but it's starting to come. It's coming from many, many different directions. So that gives me also great hope for the future.
Thank you. I think that's a great note to finish
Great,
on.
yeah.
So thank you all for joining us.